Wind Cave National Park is a complex maze of narrow passageways and chambers located underground, under the prairie, just on the edge of the Black Hills of South Dakota. My family and I took a tour of the cave this summer. It is astonishing how big and complex it is. Established as the 6th National Park in 1903, it is one of the largest and most complex caves in the world. It is over 140 miles long, but is a complex maze compacted into 1 square mile below the earth. They are still exploring and finding more of it. One of the early explorers of the cave, Alvin McDonald, was 16 years old when he was exploring the cave for miles at a time by candlelight. He knew the cave so well he guided tour groups through it. As the story goes, one time he left a group alone for a bit as he explored a new passageway. He made his way back to the surface and back home, only to realize later that night that he forgot his group. Thankfully, he came back for them. I couldn't imagine being lost in that large, complex cave without a guide. Much like the complex maze of Wind Cave, our healthcare system is also an expanding complex maze of diseases, tests, hospitals, specialists, and medications. I couldn't imagine someone trying to navigate the healthcare system without a trusted primary care provider to help guide them. People who turn to one physician, nurse practitioner, PA, medical home, or clinic for the majority of their medical care, who have continuity of care, are healthier. Studies have found that if you have one person to help guide you, you are less likely to go to the emergency room, less likely to need to be in the hospital, more likely to follow the advice of your primary care provider, and are happier, healthier, and more satisfied overall. Your personal physician is like your tour guide in the cave, guiding you along the way and helping you avoid those dead ends. Your primary care provider can be your first stop for care, catching problems early on and keeping you on track for lifelong good health.